everyone, welcome to Ask Dr. Gloria, where health and wellness are made simple and easy to understand. So, our logo here is Learn Smart and Live Well. Don't forget to subscribe, share, and like. And also share your health and wellness questions or topics you'd like us to discuss. I'm happy to help. So, let's continue. This quiz contains multiple choice questions from different competitive and academic exams. You have 5 seconds, so I'll try to pause as much as possible to answer each question. Pause the video if needed. So, the first one will be talking about the introduction to food microbiology. Question 1. Which of the following best describe the role of microorganisms in food microbiology? I'll try to pause, but if you need to pause the video before next question, please do that, but I'll try to pause for at least 5 seconds or 3. C. Question 2. Which of the following is true about Saccharomyces cerevisiae? C. Question 3. Which of the following are considered as food spoilage microorganisms? So you need to match, okay? Which one match with which one? By the way, which one is considered as food microorganism? Is it penicillium? Is it bacillus? D. Question 4. Which of the following microorganism is primarily responsible for food fermentation? So, A. So definitely not Clostridium. Clostridium botulinums, they are pathogenic. We have non-pathogenic and we have pathogenic microorganisms. Clostridium, it's very toxic, okay? It's the major cause of dangerous foodborne infections. Question 5. Before question 5, exam tip you need to know, which will help you when you think of yeast, think of beer, think of bread, think of when. Lactobacillus, when you think of lactobacillus, think of yogurt, think of cheese, right? Good. Question 5. What temperature range is considered the microbial danger zone for bacterial growth in food? B. Exam tips. 5 to 63 degrees centigrade. This is where the microorganisms like the most. So these are danger zones. Question 6. Cross-contamination in food preparation occur when? B. So cross-contaminations, another mnemonic for it is that use separate colors. For example, when it's red, red are raw meat, danger, right? So raw, red for raw, green for veggies. They can't be in the same place. These are cross-contamination. So as health professionals, you should know what cross-contamination means and how to handle cross-contaminations, because that is the only way you can teach your patient. Question 7. Which of the following food is at high risk of microbial contamination? C. Question 8. Intentional contamination of the food supply for economic gain is classified as? C. Question 9. High-risk food for microbial contamination typically include? B. So raw meat, seafoods, dairy foods. Remember, humidity. I'm sure your professors must have teach you that, or if you're a nutritionist here or any else kind of profession right here, or a student, you should know the the high danger foods, the cereals have the low danger kind of food because of humidity. So, question 10. Question 10 is about matching. Match the microorganisms with its correct role in microbiology. So, I just give you some mnemonic and some tips about lactobacillus, right? So, use it to match. A. So, question 11. The process of fermentation in food microbiology primarily involves B. Question 12. Which of the following statements about fermented food is false? C. Question 13. Waterborne food contamination may be caused by D. Question 14. What is the key differences between food safety and food quality? B. Question 15. Pasteurization is important in food microbiology because B. So I have another mnemonic for you. Pasteurization is not equal to sterilization. Okay? So it kills, pasteurization can kill pathogens, microorganisms, but not all organisms. Sterilization kills all organisms. Question 16. Which of the following is not a preventive measure to reduce foodborne illness? C. Question 17. Which bacterium is commonly associated with foodborne illness due to improper store cooked rice? So, improper store cooked rice. What foodborne illness is associated with it? Always remember the rice diarrhea, the rice stool. It's a good hint for you. B, that is the Bacillus cereus. Question 18. What is the primary route of infection for most foodborne microorganisms? Fecal route, that is B. Believe me, fecal route is one of the commonest way in which food infections happen where microorganisms are spread. So, as health professionals to be, or as health professionals refreshing their memory and listening to this, please educate your patients about the fecal oral route. It's the most commonest one and is the most unbelievable route. Question 19. What is ultimately responsible for maintaining food safety throughout the supply chain? Who? Who is ultimately responsible? Everyone. C. Question 20. Which inventory management system is in food storage prioritized using the oldest stock first to reduce spoilage? That is, which one prioritizes using the old stock first to reduce spoilage? FIFO, that is the first in, first out. Thank you for listening. I am Dr. Gloria. Until next time we meet again, please live well and live smart. Thank you. Don't forget to send in the next topic you want us to discuss about health, about anything that has to do with health, drugs interaction, and all.